Hi everybody, I'd like to welcome you to this seminar all about the different parameters to characterize laser output. First of all, what are lasers? Lasers are a type of instrument that produces a beam of light of a wavelength. Lasers are primarily used by dermal clinicians, nurses, and doctors for clinical use. As student dermal clinicians, it is important to know these as we move on to working at Victoria University's teaching clinic next year and progress into actually working in the industry in a clinical setting. We will be differentiating the two main modes of lasers, continuous wave lasers and pulse lasers. Each have relevant parameters which are important to understand as they indicate how the laser may assess if an output is reasonable or not. We will also be showing examples of cases where the incorrect parameters were used to help you better understand how they work. Continuous wave lasers are more frequently used in medical and industrial workplaces. A continuous wave laser has 6 different types of parameters including power, power density, energy, energy density, beam divergence, and beam diameter. Pulsed lasers, on the other hand, are what we use the most in dermal therapies. A pulsed laser uses 8 different parameters, which are peak power, average power, energy per pulse duration, duty cycle, pulse repetition rate, and energy density. Going back to continuous wave lasers, let's talk about the first parameter, power. This refers to the power of the machine and is measured in watts. It indicates the rate at which energy is emitted, transferred, or received. Light absorption and interaction occurs when a high power laser beam hits a material. Next is power density, or irradiance. It measures the amount of radiation delivered to a specific spot size on the skin. We can calculate the power density by using the equation power density equals power over beam area. We know light comes in the form of electromagnetic radiation and has, over the years, been theorized by physicists to exist as both particles and waves. Energy, or radiant energy, travels by waves or particles. A general example would be the light or heat from a campfire or the sun. In our case, let's think of radiant energy as the accumulated effect of an exposure to a laser beam. It is measured in joules and can be calculated by multiplying the power of the beam by the exposure time. You can find this in both pulsed and continuous wave lasers. Next is energy density, or radiant exposure. This parameter considers how much energy the laser beam is applied to the skin in a single pulse within the spot size being used. Confused yet? We'll talk about spot size in just a second. Energy density is measured in joules per square meter. Beam diameter is the diameter of the beam produced by the laser machine. This is also called the spot size. If you're trying to find the area or spot size of a square or rectangle, we would use the equation length times width. But for the area of a circle, we would use the value of pi times radius squared. Lastly, we have beam divergence, which is the increase in the diameter of a laser beam over a distance after it has exited the laser. It's basically how the laser beam expands outwards or diverges at a non-90-degree angle from its origin. An easier way to imagine this would be how the light produced by a flashlight looks against a wall versus a laser pointer. When you move the flashlight further away, we'll be quick to notice the beam divergence and spot size increases. Now let's move on to the pulsed laser parameters. Peak power refers to the maximum amount of power of the working beam during any pulse. The average power can be found by multiplying the peak power by the duty cycle. The duty cycle is the percentage the laser beam is active compared to when it is inactive during a period of time. It can be calculated by dividing the active laser time by the treatment period and then multiplying the answer by 100%. We can also calculate the amount of energy per pulse by multiplying the peak power by the pulse length. The pulse duration refers to the length of time that the energy is delivered to the skin in a single pulse. This is measured in seconds, whereas the pulse repetition rate refers to the number of pulses per second. This is measured in hertz. 1 hertz equals 1 pulse per second. Now let's have a look at some case studies where the incorrect parameters were used and resulted in adverse effects. What we can observe from this first client is hyperpigmentation around the mouth following photoepilation or hair removal using a long pulsed Alexandrite laser. Now, assessing this image, we can see that a possible source of error could have been that the energy density was too high, which means there's too much energy that the laser beam is applying to the skin in a single pulse within the spot size being used. Other factors can contribute as well. For example, the client may not have disclosed recent sun exposure, and the therapist may not have taken into account the skin type. In this next example, this client has developed keloids after an argon laser treatment of a nevus flammeus, or more commonly known as port wine stain. The power density was possibly set too high. A focusing lens may have been used, thus reducing the area of concentration and making the beam more intense. The client in this case presents persistent hypopigmentation 3 years after treatment of poikiloderma of Savat with a pulsed dye laser. Probable sources of error could be that the energy density was too high or her Fitzpatrick skin type was simply not suitable for the treatment. Another attempt of treatment was made to correct the discoloration with a pulsed CO2 laser, which unfortunately caused even more adverse effects. The client in this last example is presented with hypertrophic scars and hypopigmentation on the chin after skin resurfacing with a CO2 laser. Probable sources of error in this case are that the energy density was too high and there were multiple passes that were made by the operator on the single treated area. As future dermal clinicians, it is important that we understand these different parameters to characterize laser output in order to give our clients the best service, best possible outcome, and also to avoid malpractice. We would like to thank everybody for listening to our talk. Before we move on to questions from the audience, let's play a game, shall we?